Hey guys, Dr. Davenlin, board certified laser dermatologist. Look, thank you very much for watching this channel. For the popaholics out there, look, I started off kind of slow. I still am, I guess, in the whole scheme of things. As you know, this channel is more of an educational channel, and I do the odd pimple popping here and there. The reason why, like I said, it's like this itch you gotta scratch. And if you've ever popped, I guess, bubble wrap, you pop one little pop, you can't stop. So once you pop, you just don't stop. That's the reason why I do it. It's actually out of relaxation. Some people do it out of entertainment. But look, at the end of the day, I can promise you guys a couple of things. First of all, 2017 will be a different year. I'll work hard on my camera work. Thanks for all the positive and also the negative feedback. I really take that on board. So this is a summary of my pimple popping attempt. Remember, it's my first year at it. I hope you guys enjoyed just a summary. In 2017 will be a better year. I'll work on my camera angles, lighting, the whole lot. And once again, thank you very much for watching and subscribing. And I'll see you in 2017. Bye. Here I am using an erbium laser. I'm just using 1% of the total energy available from this laser, so it's a very powerful laser. And I'm just firing one shot. That one shot is very accurate. It gets through the skin, into the cyst wall, but not through the other side. The whole idea is to make an opening between the cyst itself and the skin so that we can extract these cysts. These cysts are also called microcysts, or submarine comedones, or microcystic acne. These lie deep in the skin, and you can just see them under the surface. They're more pronounced when you actually stretch the skin or ask the patient to put some pressure with their tongue, let's say, on the cheek. So here we go with the extractions. Once the hole is made, we can just use a normal comedonal extractor. Yes, I'm going a little bit fast with this extractions, but we've got hundreds to do in just a short span of time. So you can see how easily this the contents of the cyst are coming out. Obviously in areas like this we still need to put a little bit of pressure, but it's much easier extracting these with a laser pre-drill. Most patients require 2 treatments because, like I said, usually they have hundreds of these little microcysts. The whole procedure may take anywhere between half an hour to an hour to do. It can be a little bit uncomfortable for the patient towards the end. So you can see we're moving pretty quick. We have to move pretty quick for this one because it is quite painful for the patient if the anesthetic wears off. We're getting quite a few contents from these cysts. Blackheads, on the other hand, are much easier to extract because there's an opening between the skin and where the blackhead or comedone is. With these microcysts, submarine comedones, they're notoriously difficult to extract, and hence why I use a laser. Like I said, other doctors like Dr. Sandra Lee sometimes uses a sharp blade. Each doctor to their own. So you can see what type of cysts these are and the before and after results after just 2 extractions. So if they are on medication, these cysts do not recur. So here we are extracting blackheads. We use different instruments for different areas. Emily here likes using this instrument. We all have our favorite instruments for blackhead extractions. I like using a cup extractor, but you can see how quick Emily's doing it just using with a normal extraction. With all extractions, the aim is to actually put firm pressure down, then pull back. So perfect technique from Emily, top marks. And what I do after this is to prevent blackheads, and I use 2 creams, a vitamin A cream and also an AHA cream. So the AHA cream, which I really like to use, is something called a Neostrata, and I go for the highest percentage, so Neostrata 15, and then Zorac, which Yeah, so the second cream is called Zorak, and I like using that maybe twice a week, and that will help prevent blackheads. So it's the AHA cream which makes a lot of difference, I think, and I always go for the strongest percentage, which is the AHA 15 by Neostrata. So you can see with the correct technique, we can extract a whole heap of blackheads all in one go. I don't like using washes for blackheads because I think it abrades the skin. If you're going to put on creams, you may be overdoing it and you get a little bit of peeling. With the alpha hydroxy acids, you can get some irritation. So basically, it's trying to find out what's the best regime for you. Some people, like for myself, it's once a week. Some people need to use it every day. But the AHAs will actually unclog the pores. And obviously having a steam shower or hot water in that area would help as well. Hot towel to open up the pores. And then just a towel, soften it up. But you know what? I reckon the Roaccutane will just fix this. Seriously.
Yeah. Oh, and it keeps coming. Oh.
You want to have a look at this?
Oh, yeah, you do. Look at that.
Ew.
And then check that out. That's yours, mate. I don't want it. There you go. You can have it. So that's a good size one. I mean, that's pretty good. This is my method. So, like I said, if you're going to time it, it's 1 shot, 2 shots, 3 shots. Local anesthetic's already there. I've already got that hole which has got a minimal amount of collateral damage to the surrounding skin. I'm using an extractor with firm pressure and just extracting the contents of the pore whiner. What I'm not doing compared to what Josepha is doing is actually treating the inner wall of the pore whiner. So all we're doing is we're extracting, we're not curing. In order for me to cure this condition, I need to extract it. Once the inflammation settles down, I need to use possibly a 2 to 3 millimeter punch excision, punch excise that with 1 suture, and it's cured. So this is by far not the best method, but I think it's the quickest method with the least amount of collateral damage, and certainly can produce spectacular results like this. So there you have it, guys. Here is a comedomal nevus or blackhead nevus. This is a relatively rare condition, but I see at least 1 to 2 cases per week. This is like a birthmark, but essentially this is a birthmark that contains blackheads. So if you can see right up close, it comes as a pattern called a Blackhead pattern, and it extends from his chest all the way up to his neck. So this is called a comedomal nevus, and slowly but surely we'll be extracting some blackheads. Brilliant, we've got those. So I'm just going to repeat myself. So once again, with this procedure we have prepped the area. We prepped it using a few mechanisms. First of all, we've used some AHA or alpha hydroxy acids, AHA 15 or AHA 10, and that loosens up the comedones or the blackheads ready for extractions. Secondly, we use some anesthetic to the area, 23/7, to make this relatively painless. Thirdly, we soak the area for half an hour using a hot towel, and that's to expand the follicle and make the extractions a lot easier. So prepping is everything for comedomal extractions, especially for this kind, which is a comedomal nevus, in a hard to remove location. So remember, we're not pushing against bone here, which is what we normally see on the forehead and nose or even the cheek area. We're doing it on the pectoralis muscle, so you can see it's actually much harder. So we can use a bit of tension that way, and that way we can get into the area a lot better. Perfect technique over here. So what Katie's doing, you can see she's pushing firm pressure down, and then after that, once we get it up, we retract back. So we've got about halfway through, and they're all coming out okay. What's the pain out of 10 like, Matt?
1.
1 out of 10. That's pretty good. So you can see how painless this is once you actually use the preparation of 23% lidocaine, 7% tetracaine. Otherwise, it'll be quite an uncomfortable procedure. So for all you viewers out there, I'm trying my best to give you a clear view, but this, like I said, because this area sinks in, it's very hard to actually focus at the same time. But this is a comedomal nevus. Happens around 1 in maybe 2,000 births. Some of them are small, some of them are large. In his case, it's medium sized. So it's relatively rare, but I do see at least one a week. So to me, it's quite common. In fact, I did one just the other day. That was actually someone who was in her 30s. She didn't know what it was. She had some scarring in that area, so I treated it because she had some keloid scarring secondary to the acne. It was a comedomal nevus that was causing the scarring. That's great. What about the neck area here? Isn't much there at all to extract, or most of the blackhead's gone. Let's see, just put the probe in there and see what comes out. Oh yeah, we've got some stuff there, some keratin coming out there. Is that okay for you there, mate?
Yep.
Yep. So it's firm pressure down. See, we're still, you can see how much more stuff we're getting out with the extractor once you prep the area. Oh, that's great. There we go. it's much easier to actually extract on, as you can see when we're moving towards the sternum or the clavicle area where there's bone, it is so much easier to extract. And the extractions are so much more dramatic because we've actually got pressure to go against compared to the pectoralis area. So that's a large one we can see. See when you loosen things up how easy it is? Yeah. When you prep the skin up, it's just so much easier. It's a rare treat we prep the skin like this. It's normally the girls usually put some anaesthetic and then off they go. But in this case, we've really given it a good 5-day lead time to prep things up. So maintenance-wise, I like to maintain the areas. Yes, I know blackhead extractions are fun, but the whole idea is not to get blackheads in the first place. So what I like to do with this is, once this heals up in another day or two, he starts an AHA, an alpha hydroxy acid cream, something like a glycolic acid 15. He may do that 2 to 3 times a week to open up the hair follicle, or open up the actual blackhead, I should say. And then afterwards use a vitamin A cream such as Zorac or Tazarotene once to twice a week, and that hopefully will maintain himself blackhead free. Got a couple around there, that's great. Looks like we've just got one more around that area. Firm pressure down, and there we go. So let's do a quick scan of the area and see what's happening out here. I'll zoom out. Looks good there. Looks good there. Maybe there's a few areas within here that we can see. See what we can do there. If not, I'll use my special tool and extract. See those blackhead areas? Just see if you put some pressure on there, see what happens. Pain okay, mate?
Yep.
Yep. Are we getting anything there, Katie?
Yeah, a little bit.
We're getting a few things. Yeah, there's still a bit to go over there. Just tell me when you're stuck and I'll use my special instrument. I'm just providing counter traction that way, so it makes it easier for Katie to extract. She's still going, so we've still got quite a fair few blackheads there to go. A couple more there, isn't there, Katie? Looks like we've got most of them. Agreed? What do you reckon, Katie?
Yeah.
Mum, what do you reckon? Got a few of them out. Don't worry about the redness, that will settle down a bit.
And so these were all those ones are done?
Yeah,
Or he
they're all
tried
done.
They're all done. Let's just focus right in and see whether I can focus right in. Looks like they're empty. Yeah. Looks like they're empty. Isn't this camera great? You can
Isn't
actually
it?
zoom
It's
right
amazing.
in to see that. And
To, is that a 7?
yeah, it's a 7 times mag, so they're all done. They're all empty. No more. There's no more blackheads in there.
You're doing really well. Yeah, it sucks.
These are like, because it's in cartilage.
Yeah.
Oh. You know what you could do? Soften these up.
With hot water.
Yeah, with
Like
this
a hot
warm-
towel.
with a warm gauze in there.
Yeah.
Look at that big one there. So right, nearly done.
You're doing so well.
Put that one out. This side's a lot easier.
Don't get that on me.
Got that one. See ya.
I'm doing like
You
the
alright?
whole face this afternoon.
Doing really well holding that camera still. Got that one there as well. Okay, so I'm opening up those holes a little bit wider so I can get into them. There we go. Much easier. Put that one there. Do you sometimes give them numbing cream?
Yeah, of course.
Hey guys, thank you so much for 2016. This is my first pimple popping year. Like I said, I'm more of a procedural laser and aesthetic dermatologist, but yes, I do the odd pimple popping videos now and then. Promise you guys to do better photography, close-ups, and work on all my camera angles for 2017. And a couple of pimple popping videos on Instagram to come in the new year. So hey guys, thank you very much for the support and have a good new year. Bye.